Hi, I'm Dr. Weichert and I'm a dermatologist at Skincare West. In this video, I'm going to discuss surgical management of hidradenitis suppurativa, or HS. As you know, HS is a chronic, progressive inflammatory condition with bumps, pustules, abscesses, and scars. Typical locations include armpits, groin, under the breasts, and buttocks. It is chronic with frequent relapses. This video will focus on the surgical approach to HS, specifically explaining the surgical de-roofing procedure. In our assessment, I like to acknowledge how difficult this condition is to bear. It can be very painful, smelly, it can make intimacy difficult between partners, and few people outside of relatives and friends really understand the impact of this disease. Patients are often frustrated with limited benefit from doctors and the medicines that they've been offered to date. It's common to become reclusive, depressed. With medical and surgical management, I'd like to offer hope and establish a relationship so patients can feel safe, understood, and cared for. But let's talk more about this de-roofing surgery. During your examination, we're going to determine if an HS nodule or lesion is appropriate for surgical de-roofing. We'll discuss if you're a good candidate for the surgery, but also if you feel you can manage home care of the area after surgery. The area has to be small enough that we can treat it in clinic using local anesthetic and in a location that's easy enough to care for. On the day of surgery, the area will be cleaned. You'll be injected with freezing. This is slightly uncomfortable, but you won't really feel anything in the area afterwards. The overlying skin will be taken off surgically, and the underlying inflammation will be removed with a scraping technique. The wound will be left open to heal, and a dressing will be applied. Wound care will be reviewed thoroughly, but you really need just a shower, soap and water, and a plain ointment like Vaseline or Aquaphor, as well as daily dressings. I often reassure patients that the discomfort of this surgery is often less than managing an active HS nodule at home. Here are some frequently asked questions about the de-roofing procedure for HS. Number one, is it under general anesthetic? So no, it's actually done right here in the clinic with your dermatologist or surgeon, and we use topical injection freezing until you're numb in the area. The anesthetic will last about 2 or 3 hours, and after the freezing sets in, the scarring is followed all the way to the edges and the inflammation is removed. Your appointment will last about 30 minutes for one location of de-roofing surgery. Number two, can I do multiple de-roofing surgeries on the same day? Well, the answer is yes, but I usually only do one spot in your first visit. And that helps you get familiar with taking care of an open wound so that future procedures are less intimidating. Many patients eventually will undergo 5 or more de-roofing surgeries, but each site does require attentive care at home. Which lesions are best suited for de-roofing? De-roofing is best suited for persistent, isolated, stubborn abscesses that have even been injected with steroid but still recur. Number 3, how do I take care of the wound? The wound care involved is quite simple actually. All you need is Vaseline or Aquaphor. You'll need to wash the area gently with soap and water using only your hands, and after that, you apply the ointment once a day, followed by a dressing. That's it. Since there's no stitches, the wound heals open, and it can take 3 to 4 weeks to heal completely. And often this spot will no longer become inflamed or painful again. Number 4, do I need to take time off of work? You don't necessarily need to take time off of work, but you might feel more comfortable taking a few days, depending on the area of surgery. Often the healing discomfort is quite mild, and even a Tylenol or an ibuprofen is enough. I reassure you that the healing is quite straightforward, and most people find almost instant relief of the chronic pain. Number 5, can I exercise afterwards? Vigorous exercise or going to the pool should be avoided, depending on your level of comfort, and light exercise is usually tolerated the first week. I hope the information you've heard today is helpful to inform you and reassure you that the de-roofing procedure is safe and effective for hidradenitis suppurativa. But remember that both medical and surgical techniques are required in combination, so there's no one way to treat HS. Each patient is unique. Skincare West has treated hundreds of patients with HS, and this condition is actively being researched for new therapies. If you would like to access more information developed by Canadian dermatology colleagues, go to www.hsfoundation.ca, and there you will see a free online book on HS and much more.